Hello, and welcome to the OhioHealth Survivorship video lecture series. My name is Dr. Andrew Freeman, and I am the Chief of Radiation Oncology for OhioHealth. And today we're going to be talking to you about COVID and cancer care. So just a brief overview, I want to talk about the coronavirus itself. We've all heard a lot about it in the media. Talk about it specifically and how it impacts you, your cancer care, cancer survivors, and what are the most common questions that we have been asked about the association between COVID-19 and cancer care. So today's presentation is going to take some of those most frequently asked questions and provide you specific answers as to how you should be looking at COVID in your world. So COVID-19 is a coronavirus disease, 2019. So coronavirus is not a new virus specifically. This is just a new virus to the coronavirus family. It's caused by a novel or new coronavirus that was first identified in an outbreak in Wuhan, China in December of last year. Coronavirus is a large family of viruses that can cause anything from mild, minimal illness to very severe disease, such as severe acute respiratory syndrome, or SARS, as well as the Middle East Respiratory Syndrome, MERS. Because the novel coronavirus is related to the SARS-associated coronavirus, it gets its so-called name, SARS-CoV-2. What I want you to realize is that it's taken us decades to learn what we know about most viruses, and so SARS-CoV-2 is very similar. We're learning very quickly, but there are many things that we are still learning as we go through this pandemic. How does COVID-19 spread? The virus can spread from person to person, as we know. Most of the time, this is through small droplets from the nose or mouth that are produced when people cough or sneeze. This is why mask wearing is so imperative in preventing the spread of COVID-19. Another person may catch COVID-19 by breathing in these droplets or by touching a surface that the droplets have landed on and then touching their eyes, nose, or mouth. Most commonly, this virus is spread through close association, generally within 6 feet, which is why we say social distancing should be at a minimum of 6 feet. But sometimes this virus can spread by airborne transmission. So what is the difference between droplets and airborne transmission? Well, in small spaces, these viruses can remain airborne for minutes to hours, and can infect people even more than 6 feet away in these situations. This is why very high-risk activities such as dining inside restaurants, going to weddings and other large group settings in an indoor environment can provide access to super spreader events for COVID-19. So as a cancer patient specifically, what makes you more vulnerable to COVID-19? Well, if your immune system is compromised, you are at higher risk of severe complications related to this virus. Cancer diagnoses and the treatments associated with them can weaken your immune system by decreasing your white blood cell counts and affecting your body's ability to produce antibodies to fight the infection. Both of these can have a severe impact on your body's ability to fight this infection. In other situations, some degree of immune suppression can last many months to even years after your cancer diagnosis and treatment. So even though you are through your acute treatment of your cancer, you may always be at somewhat higher risk related to COVID-19. What if you are currently undergoing treatment for your cancer diagnoses? Luckily, the data we have to date shows that your risk of contracting COVID-19 during cancer treatment is relatively low, on the order of 1% to 4%. That is based upon your hospital and doctor's offices taking extreme precautions trying to prevent the transmission of COVID-19. In addition to being a cancer patient, you may have other comorbid conditions that could increase your risk for coronavirus infection. These could be lung disease, diabetes, hypertension, cardiovascular disease, and all of these can contribute to your risk of complications related to this infection. If you're concerned about any of these risk factors or would just like more information, please contact your primary care provider or oncologist to discuss this. What can you do to keep yourself safe? Follow standard precautions. To minimize the risk of contracting COVID-19, avoid touching your face, wash your hands repeatedly, use hand sanitizer throughout the day, and use a hand washing station if available. Wipe down any frequently touched surfaces. Continue practicing social distancing guidelines, staying at a minimum of 6 feet away when possible, and follow any other government or guidelines or recommendations as they continue to come out. Every time you exit your house, consider the circumstances that you may encounter, anticipating what you may need and having everything available to you before leaving your home. Wear a mask when around others, or where you might have a chance of having social interaction that might be unplanned. When possible, leverage technology to remain socially connected. Avoid contact with anyone who has symptoms of COVID-19, which would include cough, fever, sore throat, difficulty breathing, chills, muscle aches, headaches, or loss of taste or smell. Avoid any large gatherings and locations with high foot traffic if possible. Consider using delivery services whenever they're available. If you're a high-risk individual as a result of your cancer diagnosis, cancer treatments, or any other comorbid conditions, you might find it a little difficult to explain to your friends and family why you're taking such steps to protect yourself. Here's some things that you might want to highlight when you're talking with your friends and family about this. Discuss that your illness puts you at a higher risk of developing severe complications related to coronavirus infection. Explain that virtual encounters are safer for you and allow you to remain socially distant, but also socially intact. Ask for help with getting essentials delivered to your home. And remember, how your friends and family live matters to you. Every time you interact with friends and family, you have essentially had contact with everyone that they have encountered. Encourage them to practice appropriate social distancing and mask wearing to protect you. What should you do if you're experiencing symptoms of COVID-19? They can be mild to severe and may appear between 2 and 14 days after exposure to the virus. Symptoms again include fever, cough, shortness of breath, chills, headaches, sore throat, and a new loss of taste or smell. Other symptoms may include aches and pains, fatigue, nasal congestion, and even runny nose or diarrhea. In some people, the illness may become severe, causing pneumonia and heart issues. Other people who are infected may have no symptoms whatsoever. If you are experiencing any symptom of COVID-19, please contact your primary care provider or oncologist immediately, especially if you're in an immune-compromised state. Until you have been evaluated, you should isolate yourself, quarantine yourself from others within your home, and monitor yourself for worsening symptoms. These would include fever and worsening difficulty breathing. If symptoms become too severe before you can be evaluated, you need to go to the emergency department. Your care team will coordinate and work together to get you the medical attention that you need as soon as possible. Our physicians and healthcare professionals stand ready to provide you with monitoring and medical support whenever you need. So that cancer screening that you need, you still need it. If you had an appointment for screening in the early parts of the pandemic, this was likely delayed or canceled. You need to talk with your healthcare provider about the urgency of getting these tests rescheduled for you. Screenings are meant to detect cancer at an earlier and typically more treatable and curable state. This is an important part of your healthcare maintenance, and we have taken several steps to make these processes safe during the COVID-19 pandemic. Should you delay seeking medical care for either cancer or other uncancer-related issues? No, please do not stop your medical care. If you are having any issues or symptoms that are concerning for a cancer diagnosis or any other major medical condition, you should not delay in seeking medical attention because of the current pandemic. How will COVID-19 impact your cancer treatment? Well, when we think of treatment for cancer, it generally involves one of three arms: surgery, chemotherapy, and/or radiation. Early on in the pandemic, elective surgeries were being delayed to conserve PPE. At this point, though, OhioHealth is not currently delaying any elective surgery. However, if the pandemic conditions continue to worsen, your physician may discuss with you about options of safely delaying your surgical procedure until a it is more appropriate time. In terms of radiation therapy, this generally involves daily trips to a medical office building, which could increase your exposure risk. However, radiation is still an important part of appropriate cancer treatment. Your physician may discuss safe alternatives that may delay the initiation of radiation therapy. They may also discuss alternative scheduling of your treatment to decrease the number of visits required to the office. Anti-cancer treatments or systemic therapies will require a discussion specifically with your oncologist regarding the risks and benefits of that specific treatment and the scheduling associated with it. There is no evidence to support changing or discontinuing this treatment secondary to COVID-19. What is OhioHealth doing to protect its patients and staff? Daily health screening of associates, including temperature monitoring, using hospital-grade personal protective equipment, or PPE, that is appropriate for each associate's role, requiring all associates and providers to wear masks, providing masks for patients and approved visitors, rigorously enforcing hand-washing protocol. We're also constantly reviewing all of our clinical and operational processes with a team of certified infectious disease specialists to ensure the highest level of safety for both patients and staff. We are using hospital-grade cleaning products that are approved by the United States Environmental Protection Agency that are known to kill the coronavirus that causes COVID-19. Developing innovative ways to limit in-person contact, such as moving monitoring equipment out of inpatient rooms to preserve PPE, and also using phone and video visits to try to keep patients out of our medical office buildings. All patients undergoing planned surgery or those initiating cancer treatment are all being tested for COVID-19 regardless of symptoms. In conclusion, cancer patients are considered high risk for COVID-19 and for developing more severe complications. The risk of contracting COVID-19 during active cancer treatment is quite low. You should not put off your routine screenings and other medical care because of the ongoing pandemic, and OhioHealth has and continues to take great measures to keep you safe at all of our healthcare facilities. Thank you for your time.